Hey guys, my name is Tiffany and welcome back to another video. So actually, I'm going to be starting a new mini series with you guys. So I've done a series on my channel that has been gaining a lot of popularity with you guys. It is my Tiny Tips with TIFF series where I teach you skills in the NICU, and you guys loved it so much that I thought I'd do a different little mini series called Tiny Talks with TIFF, where basically I'm going to be answering some commonly asked questions from NICU parents and kind of addressing them how I would as a NICU nurse. So of course, this is for anyone, for all you NICU parents out there that are watching this video. Hopefully some of these questions can answer some of your concerns that you have regarding your baby in the NICU, but I do want to also kind of share with you guys, especially as new grad nurses in the NICU, kind of really how you would approach these questions, because honestly, as a new grad, there was a lot of things that I didn't really experience yet, so I wasn't sure what to really give advice to the parents, or like an expected timeline of things to the parents and some of the questions that they asked me, because I've never really experienced it before. So hopefully this series is helpful to you guys, especially those who are new grad nurses in the NICU or just learning more about the NICU or NICU parents. Hopefully this mini series is helpful to you guys to answer some common questions asked in the NICU.
'Cause anywhere you feels right, anywhere you feels like Paris in the train.
So this first episode is going to be talking about how can I be involved in the NICU? I am too scared to touch anything. So as a NICU parent, I get a lot of parents coming in, especially first-time parents, or just, of course, this environment is so new. No one has really known about the NICU or what to expect in the NICU, and so they see tons of like things beeping, so many wires, all these tubing. Like, I am so scared, even for me as a NICU nurse sometimes, like all the stuff, it can be overwhelming to look at. So we have some parents that are just like, I don't want to touch my baby, I don't want to be involved, just because there's just so many things, I don't want to mess with it, I don't want to ruin anything, which is understandable. It can be overwhelming to see and look at, and so I just want to kind of address with you guys how you can kind of reassure your NICU parents, and for those who are NICU parents out there, how you can really be involved in the NICU, because we really, really want you to. And so one way to be involved is being a part of rounds. So usually on day shift, we have what's called nursing rounds, where all members of the healthcare team, typically all the doctors that are taking care of your baby, the nurse is usually there, of course, and then just any other providers if they are available, like pharmacy, dietitians, any specialized people in your care team will try to make it to rounds, and we kind of talk together as a group regarding the patient. So it's really nice when we also get parents involved in that as well, just because then it's really a chance for you to ask any questions, bring up any concerns, and kind of go over things that we are expecting regarding the plan of care. So it's nice to, of course, be involved in it and kind of getting the rundown of what's going on and everything like that. There are going to be times, though, where you as a NICU parent may be hearing some things that you are not familiar with. There's going to be a lot of terminology, a lot of numbers that are going to sound very confusing, and it's okay for you to ask your provider, and of course, this will always be something that the provider should follow up with, but at the end, usually we like to summarize things and make it more easy to understand in lay terms, but we do like to go over just numbers and things like that, so that way all team members can understand and be aware of like lab values and such things. And so we will go over those numbers, and so if it sounds confusing to you and like literally an alien language, don't worry about it. Usually a lot of times we try to make it easier to understand and summarize everything at the end, but especially like being involved in that is super important. And so that's one way that you can be involved regarding your baby's plan of care, is just being involved in rounds and kind of getting an understanding of what's going on. The second thing on how to be involved is, if your patient is super unstable, it's really nice for when you can have the parents be involved in some ways. And I know there's just a lot of things going on. Sometimes the baby is so unstable that, there's just so many bodies surrounding the patient that it's hard for the parents to really connect with the patient, because they just see so many people doing things to their baby. But of course, when you get to a point where you're at a more stable place and your baby's a little bit more stable and everything has kind of been organized and things like that, then really have the parents be involved. And so we've had some unstable patients where still the parents can be involved somehow by doing hand holdings and just any sort of good stimuli touch. Of course, we don't want to like poke and prod and like, really bother the patient when they're asleep. But if the patient is nice and calm, it's really comforting for some of the babies to like have a hand on them. And so we like to tell the parents to like put a hand on like kind of where their feet and their butt is and kind of like really push them in, because they're used to this very tight environment in the womb, and so kind of like making them feel like they're contained really helps with comfort. And so we'll like kind of push their feet in closer to their chest, to their body, and then also you can put like a hand over their chest too. It really helps to comfort them as well, because we do even have medical devices that we use in the NICU. They're like bean bags most of the time, little bean bags that are used as like positioners, so we can reposition the baby, but they're also used as a sense of comfort as well. Just having that just pressure feeling on the baby really comforts them, and so that's something parents can do to be involved, especially if their baby is very unstable. Just doing a little bit of a hand touch that is good stimuli and doing some containment is really comforting as well, especially during a procedure. So we have instances where we're doing eye exams in the NICU, or we're doing any other sort of procedure like labs and the baby's crying. It's really nice to get the parents involved too and have them contain the baby, so they can be focused on getting the pacifier and really doing really positive stimuli touch for the baby while we're doing the procedure that we need to do. So that's another way to get parents involved as well. Another way to get parents involved is doing skin to skin. So if your patient, of course, is at a stable place where they are able to do skin to skin, really encourage that as much as possible. And of course, it's important to kind of time it during care time. So that's when you're going in to do your assessments, and timing it around that time so you're not constantly putting the baby in and out, constantly doing unnecessary touch and stimuli to the baby. So usually I like to tell my parents, typically we do our cares every 3 hours in the NICU if my baby's eating. And so let's say my care times are typically around 8 o'clock in the morning when we start our first assessment on the baby. Then I'll tell the parents, if you want to do skin to skin, like maybe come a little bit early, around 7:30, and that way we can get you situated, get the baby all situated as well, changing the diaper and things like that, and then we could do skin to skin. That way I'm timing it well, because it's very important to do clustered care in the NICU. So basically clustered care is when we try to do our care times at the same time, and we have other people that need to be involved in the cares and doing it all at once. So let's say if the respiratory therapist needs to come in to do cares as well, then we're doing it at the same time, and they're not doing cares at a different time, and you're not doing cares at a different time, and then it's just so much unnecessary stimuli on the baby. So it's really important to kind of coordinate your care with any healthcare team members, and that way you're doing clustered care for the baby, and that way it could prevent any unnecessary stimuli on the baby, and also coordinating care if you need to do skin to skin, and having the parents be involved in that way as well. Another thing too is when you get to a point where you're starting to do baths and feedings, definitely get the parent involved. So we have some parents who are coming in for the first time and never changed a diaper before, never fed the baby before, never gave a bath. So those are all great opportunities for you to do some learning and teaching with the parents. And so we have some parents who are so scared, especially if it's like their first baby, or just being in the NICU, there's so many wires, tubing, things like that, they're just so scared to change a diaper. So encourage the parents to be involved, and you can demonstrate to them how to do it the first time, and then that way they can feel a little bit more comfortable, or just be there and be encouraging for the parents, so that way they could feel a little bit more comfortable with the environment. So usually for me, what can make it a little bit easier is me holding some of the wires and like detangling it, so that way the parents can actually change the diaper without those being in the way, and just things like that. So that's one way to do it. And then also for me, I love giving baths in the NICU, and so it's just one of those things where parents are a little bit hesitant at first just because they're not sure how to do it. But if you teach them and really be encouraging and involving, having the parents be involved, then it can become a wonderful thing. And sometimes the babies may or may not like it, but at least the parents can be involved and feel involved somehow, caring for their babies. So I love showing the parents how to give baths and like ways that I like to do it and things like that. And there's many ways to give bath, but I like to kind of have the parents be involved, and that way they can learn from different nurses on how to give baths to the baby at home. And then same thing goes for, when it comes to feedings. A lot of parents feel hesitant to feed, especially their preemie babies who have, really no sense of suck-swallow coordination yet. And so it's really important to do a lot of teaching to the parents and have them be involved on really how to pace and feed your baby. So I've done a video on that, so make sure to check that out in the cards above. But yeah, basically really showing them techniques on how to do sideline feeds, pacing, things like that, because it's a learning thing that not everybody really knows about. So we really want to encourage parents to be involved in feeding their baby and showing them proper and safe techniques on how to do so. Hopefully this video was helpful for you guys who are new grad nurses in the NICU or parents in the NICU on ways you can be involved, and showing parents how to be involved as well. So hopefully this first episode of this series is helpful for you guys to get a little bit of an understanding regarding that, and I will see you guys in the next episode of the series. Bye!
'Cause anywhere with you feels right. Anywhere with you feels like Paris in the rain. Paris in the rain.